everyone, it's Shauna Young, occupational therapist and owner of Mountain Therapy Services. Today, you're going to want to stick around for this video because we're answering all your questions regarding driving after a neurological event. As an OT specializing in stroke and brain injury rehab, one of the common questions I often get is, when can I get back to driving? Understandably, it's an important question because for many of us, driving is an expression of freedom and independence and a means for getting to our workplaces, our community, and connecting socially with others. After a brain injury or stroke, you may have experienced changes in your physical, cognitive, visual, perceptual functions, and that would affect your ability to drive safely potentially. So here to answer some of our questions with us is Jan Stephanides, a guest expert. She is a certified driving rehab specialist and an occupational therapist in Morganton, North Carolina. So welcome, Jan.
Hi, thank you for having me.
So I was hoping you could tell us a little bit about your role as a certified driving rehab specialist, or a CDRS, we might say, and sort of the specialized training that you've had.
Like you said, I've been an occupational therapist for more than 35 years. I went into the specialized area of driving probably 15 years ago. There is an association called ADED, the Association for Driving Rehab Specialists, that does all the education and the certification to be qualified to make decisions about driving. We have included the ADED website at the end of this, which is ADED.net, ADED.net. To be a certified driving rehab specialist, it's based on what kind of professional education you've had. So I have a 4-year degree and a master's degree, and I needed to get 1,600 hours of driving experience working under another CDRS before I was allowed to take a national certification exam. There are about 350 of us in the country and in Canada. That number is growing. And that's why we willingly work with experienced occupational therapists to help determine if people should drive, like you.
Right. Okay. Yeah. So I know I refer patients to you when I'm wondering about their abilities to drive and wanting that behind the wheel assessment. Who are the other major referral sources, and kind of what's that referral process look like?
So lots of physicians will refer to our program. I do not have to have a physician's referral to see someone. So if there are people that need an evaluation, they can just call our office and have a driving evaluation. The DMV also sends a lot of clients, in Western North Carolina. I'm the closest evaluator, so I get a lot of referrals from the DMV as well.
Yeah. Okay. One of the questions I get a lot is, after a stroke or a brain injury or some neurological event, have I lost my license? Have I been reported? I know there's a medical review process. I wonder if you could kind of tell us a little bit about that.
So the medical review process in North Carolina, it's a positive thing because we want people to be safe when they're driving. And so typically, the medical review board will send out a letter to you that says, have your physician fill out this form. And what the form says is that they believe that you have the skills to be able to drive. But a lot of times the physicians really don't know. I mean, they see you in their office for, a brief time, and they've got to make a decision about that. So sometimes the physicians will say, go have an evaluator evaluate you. And again, it's a positive thing because our role is not to take away somebody's driver's license. It's to help figure out if you're still safe to be able to drive, and can we modify the environment to make it so that you can continue to drive. So the DMV process can be frustrating, but it is also, you don't want to be driving on a road with somebody that shouldn't be driving. So they're there to help us figure this out.
Right. I think as OTs, that's our main job, is how can we help people safely do what they need to do, their activities and their roles. But we do have to be responsible for ourselves and for others out on the road. And that's a way to do that, is for that
Exactly.
individualized assessment. Yeah. Okay. So when someone's referred to you, what does a comprehensive driving evaluation look like on your end?
So usually it takes about 2.5 hours. I look at you physically, your arms, your legs, and your neck. in relation to driving. I spend a lot of time on vision because 90% of the decisions you make when you drive are based on what you see. And it's different than what an eye doctor does. I'm looking at how you process that visual information and if you can use the information fast enough, because driving requires you to process fast. I also do a cognitive assessment. It's not about how smart you are. I'm looking at your memory, your ability to multitask, your processing speed. We kind of look at all those things. I also look at attitude and behavior. Are you aware of your deficits, or are you angry about your deficits? All the things that can affect driving. So we kind of take all that stuff into consideration. And if I have concerns, I'll tell you, and I'll tell you how those concerns affect driving. And then together we'll decide, are we going to take a driving test? And then at that driving test, it's your job to prove to me that my concerns don't affect your ability to drive. So, when we do the driving part, you know exactly what I'm looking for and what I'm asking you to do. And, it's not to try and trick you. It's just show me that you can manage the car. And again, it's kind of not an all or nothing. It's, can you do it? And do we need to modify it some by putting restrictions on it, or so it's trying to figure it out together.
And I know you see a lot of that play out, like you were saying about attitudes, just energy level, emotional stress, the pressures, because driving's one of our most, if not difficult or challenging, complex activities of daily living that we do.
That's right. And just because it requires the highest brain function to be able to drive. It seems like a simple task, but it really requires very complex cognitive tasks to be able to safely manage, a 2-ton vehicle. So, yeah, we take all that into consideration.
So I imagine that gives you a lot of opportunities to work with the other members of the rehab team, when somebody has had some kind of neurological change and changes in their physical function, working with their physical therapist, on their ability to move their leg with the reaction time they need, or their OT, or maybe neuro-optometrist when necessary there too.
Exactly. So, we might come and spend an hour doing clinical testing, and I might say, let's not do the driving test yet, because ethically, if you can't drive, I have to report it. I should report it. So if we hold off on the driving test, a lot of times I'll say, okay, here's what I want you to do. Go see a neuro-optometrist and let's do some vision therapy because you've got some neglect. Or let's go work with your PT because that right leg still has a little bit of abnormal tone. Let's see if we can fix it. Or let's think about using your left foot to drive. Let's go work with a therapist and let's get it good and strong and see if that's a possibility before we do the behind the wheel. And sometimes we do the behind the wheel. And again, I might say, let's still think about getting some therapy and come back and we'll do it again.
I like the positive light on that, is just that collaborative approach with the goal of we're trying to get you back to driving, and
Exactly.
yeah, let's do it in a timely way. Yeah, that's great. So maybe if we could speak a little bit into the different areas. So I know a lot of our listeners have experienced changes in their physical function, whether that's strength or coordination, the change in their muscle tone if they have spasticity. And so I wondered how you're looking at that and sort of adapting, the vehicle or using strategies with those clients when you see that.
So a physical deficit like abnormal tone, my personal opinion is if there is abnormal tone, I am not going to use that limb to drive. That is not an all. That's not a definite, but generally speaking, if a stroke has affected your right side, I'm not going to use your right leg to drive. I'm going to think about using your left leg to drive, or hand controls where your right side is not controlling the steering wheel, which is the finesse. I might put your right hand on a gas brake, but for example, so we can modify the vehicle, or when I'm looking at physical limitations, another big one is sensation. If the sensation is impaired in your feet, I won't let you drive with your feet because you got to be able to feel. And again, that might be a reason why we would recommend hand controls. There's a lot, neuropathy is fairly common. And if you can't feel the pedals, I don't want you using that, because those are the ones that miss the brake or
Right. Yeah. And proprioception, just knowing, where
how
their
much
foot is in
pressure.
space and how much pressure, right? Are they sustaining the pressure adequate and the force adequate?
Yep. Yep.
Yeah. Yeah. And then there's other equipment too, right? Like steering knobs. I know that kind of gets tossed around loosely.
So
And I
if
kind of
you're,
wondered what that looks like.
yeah, so there are a lot of one-handed drivers out there. So maybe your legs weren't affected by the stroke, but maybe just one arm is. And a steering knob is a very simple modification that allows you, a one-handed driver, to safely operate the vehicle.
Mhm.
That's a great modification. We can also put adaptations on the turn signals so that you can easily reach it one-handed. We can make them electronic, so you just touch a button and the turn signals and the wipers and the dimmers, all that can be operated, via electronics. So
Right.
I have a vehicle that we can try all that kind of stuff out. So
Yeah, okay. Yeah, actually, and going to that, that's interesting to talk about too, is what is your vehicle like? You must have some safety guards
So
in place for
I
you.
have a vehicle that, of course, we clean it after every client because of COVID. COVID changed the way we do things. My vehicle has a training brake on it, so it's just like your driver's ed car. So I can stop the vehicle if I need to. And I have adaptive equipment that I can attach to. So I have a left foot accelerator. I have right side and left side hand controls. I have extra mirrors. I have extended steering wheels. I have smaller diameter steering wheels. I have a lot of just equipment that a client could try with me to see if it does seem like something that they would be able to do.
Hmm. And what would you say about, I also casually hear about people just, I'll use a crossover of my leg approach to driving, and I can just get away with doing that. What would you say about that versus using the equipment that you recommend?
So there's no law about using the left foot crossover, which is what a lot of people do. If you have an amputation, oftentimes the prosthesis will allow, once you get that prosthesis, you can't do the left foot crossover because the prosthesis is in the way.
Mm.
Um, there are also some research that shows that you end up with hip problems because of the abnormal angle that you have to use to do that left foot crossover. And I'll give you an example. I had a client come in who drove to me for his evaluation. He was a right amputation and he did left foot crossover and he was not having any trouble. When I evaluated him, he had full neuropathy in his left foot. I mean, he did not feel one thing. Her
Mm.
perception and sensation was totally gone.
Mhm.
So unfortunately, but I put him in the car and he tried hand controls. He's like, I had no idea this would be so easy. So he's going to drive with hand controls. But, the left foot crossover can work, but everything, you got to have sensation to be able to do left foot crossover.
Mhm.
And generally speaking, hand controls are so much easier than trying to do left foot crossover.
Wow, that's interesting because I'm sure a lot of people don't think about that it would be.
And the other thing too is if you've been driving with your right foot for all these years, in a stressful situation, you're still going to go to the left for your brake.
Oh, right. Yeah.
Yeah.
Mhm.
So anyway, it's just
Yeah. Does it when you get equipment like that to adapt the vehicle, does that require a physician order or
so no, it does not require a physician's order, but in the state, in all of our states, you need to have that restriction on your driver's license. So we'll tell you, you can get hand controls online
Mhm.
and you can put them in, but they have not been installed by a certified dealer. It is a C clamp on your pedal. It can come off.
Mhm.
You can be charged with driving while impaired because you have changed the operating system of your vehicle illegally. So it is recommended that you have an evaluation and that you are trained to use the equipment and you pass a DMV road test using that equipment. Then we put it in your car.
Got it. Okay. Yeah.
And so you want to make sure that it's a certified dealer, and that's a NMEDA certified dealer. That's a QAP certified. That means they've been trained by Ford. They've been trained by Chrysler. They've been trained by all the major manufacturers to be able to change the operating system of the vehicle.
Got it. Okay. Yeah, that's important. And just the training involved, I'm sure, with being able to
Yeah.
do that before they test with it, like you said. Okay, yeah. Well, let's talk a little bit about vision. I know a lot of people just think about vision from the perspective of, like how clear their vision is, whether they need glasses, contacts. But after a neurological event, people may experience change in their visual field. They may have a hemianopsia where they're just missing that visual information. Imagine that's a red flag that you look really carefully at on your end behind the wheel.
Right. We spend a lot of time on the vision. And after a neurological event, two common things are the visual field cuts or neglect.
Mhm.
And both of those are huge red flags for driving. In the state of North Carolina, it's depending on how they qualify or classify your visual um, field deficit. So if it's a synonymous hemianopsia, which is the total sight, complete loss of the sight, in North Carolina, you are not legally allowed to drive. So there are a few exceptions, some specialized training. We have gotten a few clients able to drive with a synonymous hemianopsia. If it's classified as a quadranopsia, which means just a quarter of the vision is gone, you can legally drive, but you must have specialized training. And we do work with clients. Sometimes we do extra mirrors. Sometimes, we teach a lot of compensatory strategies just to compensate for that big hole in their vision. Neglect is another one that is sometimes that can be contraindicated for driving. It just depends on how severe the neglect is. And, every case is different. So
Right.
in North Carolina, the other thing is you got to have 60 degrees of horizontal visual field. So that means you got to have 60 degrees in one eye or 30 degrees in one and 30 degrees in the other. So there are some requirements. And again, it's not cutting hard and fast, but that's the starting point.
Okay. Yeah, those are the clients I feel like I end up working a lot with towards that goal of driving is they are the ones who have some kind of neglect or inattention towards one side. So it's, the people who are maybe bumping into things on one side, missing information, they're in the store and not noticing people approaching. Other times I see too, I don't know about you, but clients who it's almost like a tunnel vision where they can focus on something forward, but when there's the multi-sensory challenge of having to integrate their peripheral information, they sort of block that out unintentionally or just are not perceiving that or able to integrate it at the same time.
Yeah, so
Um,
that one will really show up when we do the behind the wheel.
mm,
And I really challenge that one. One of the tasks that I have you do when you come and take a driving test with me is I'm going to ask you to call out all the speed limit signs on the side of the road and then look down at your speedometer and tell me how fast you're going, because that requires you to use far vision to see that speed limit sign and quickly shift to near vision to see your speedometer and still keep the car on the road. And that's a great example of clients that tend to do what we call tunnel vision.
mm,
They're just looking at the road right in front of them. They really can't process this stuff around. And when we get back to the clinic, I ask, what did I want you to do? And they say, oh, I called out the speed limit signs. And I said, well, how do you think you did? Oh, I called them all out. And they've called out 5 and we passed, 20.
mhm,
They missed 75% of the speed limit signs. Does that
mhm.
mean they shouldn't drive? Not necessarily, but it does mean that they are not able to process quick, fast, and we're going to put some restrictions. I mean, it might mean that they can't drive. It depends on what else happened, but tunnel vision is a problem just because that indicates that they're not able to multitask and process all the sensory information around them.
And I imagine that isn't as obvious to caregivers or the client because it comes out more in those really challenging environments or activities like driving.
Speed, the
Mhm.
faster you go,
Yeah.
that's where it shows up. And that's why behind the wheel evaluation is great, because it's really
Mhm.
going to it's going to show you areas that you need to work on and why it might not be safe.
Right. And I think as therapists, we can really try to help the patients challenge them more in those areas of dual tasking and,
Exactly.
divided and alternating attention to try to help progress that
And
ability.
if they can walk and move,
Mhm.
moving and visual tasks, that's very challenging, but that's what driving is.
Right. Yeah. Yep. And then, so do you refer patients out to like a neurooptometrist at times to help? And also, am I right that there's a specific form that sometimes is required by an
So
optometrist with visual deficits?
yes, there's a DL-77 form. You can get it online at ncdot.gov. You can type in medical forms, and there is a vision form that the DMV requires if there are visual field deficits,
Okay.
and a physician needs to fill it out. And if it's a neurological, cut and dry, not going to ever change, you probably only have to do it once. But if
Okay.
it's a progressive visual issue that could potentially change, then a lot of times they ask you to have it done every 6 months.
Okay. And for those of you listening, I know that it varies state to state, right, on the requirements visually, and for all of these requirements for going back to driving. So, again, we'll put some links down below so that you can access your state specific information, but also to find, say, a neurooptometrist near you, we'll put a link in the description for that as well. So,
Mhm.
um, well, let's speak a little bit about cognition. I know that is obviously a really huge component of driving in terms of attention and judgment, memory. I wondered kind of how you assess that and challenge that behind the wheel.
So I do standardized testing. Because of time, I don't I just do parts of different tests. The ones that I do use, I have a lot of good research behind it and how it relates to driving. Um, and generally speaking, memory loss and driving don't go together. And the example that I gave you, call out all the speed limit signs during the driving test. A lot of times clients can't remember to do that. And by the end of the test, they don't remember that it was asked of them.
Mm,
That's a big red flag because you really shouldn't be driving if you can't remember where you're going. Um, Driving is a complex cognitive task. And if you can't remember where you're going or how to get there, then your mind is focused on, oh my goodness, where was I going? Where was I going? You're not focusing on the task of driving. That's kind of why memory loss and driving just don't go together.
mhm.
But again, just because you fail a memory test doesn't necessarily mean that you don't drive. If you can demonstrate some good memory while we're driving, for example, calling out the speed limit signs, then we've got some options for you.
Mhm.
But you really have to be careful about memory. Multitasking is another critical skill that you need to be able to perform while you're driving, because driving is ever changing and you've got to be able to pay attention to the most important things.
Mhm.
So
Mhm.
that's also challenged. There is some research that the Canadian Occupational Therapy Association came out, which I thought was pretty interesting. We don't follow it, but basically it says that if you have one impairment due to cognition in your IADLs, then you shouldn't be driving. And that really struck me because, we're talking about if you can't shop or you can't do your hobbies anymore, or you can't operate the telephone, or you can't handle your checkbook.
Mhm.
Um, you can't operate the tools that you used to could. That would mean you should not be driving. And
Mhm.
there's a lot of people that, because of cognition, really can't do those IADLs anymore.
Right.
And of course, we as therapists know this, but if you're not able to get your clothes on, if you're not able to brush your teeth, if you're not able to feed yourself, those are
Mhm.
all basic personal ADLs. If just one of those is impaired,
Mhm.
it's recommended that you don't drive.
Mhm.
I mean, we
Mhm.
don't have that rule, but I found it interesting.
Yeah, I do too. And I see that with clients that I've had too, is just the caregiver is taking over more of those roles, and it's hard to have that conversation about driving and also taking that. But it's, when somebody's saying to me, well, they're just going from here to there and back. And I feel like I need to just ride with them if they're if they're going to a new place, or they're um, those
Yeah.
are red flags for me to ask more questions about what's going on and how they're performing.
Yeah, just remember that going from here to there,
Mhm.
all of that usually involves a parking lot.
Mhm.
And parking lots are high risk for crashing because it takes a lot of visual perceptual skills to navigate a parking lot. You have to pay attention to a lot of multitasking, and there's pedestrians around.
Yeah.
So, bump ups in a parking lot are kind of the first red flag that maybe driving isn't going as well as we think it is.
Yeah. And I think it's tough too because a lot of clients after a neurological event, they may have difficulty with their insight and judgment. And I think it's important to have open communication. It's a difficult conversation for some to have because of the importance to us of being able to drive. But we really have to be getting that feedback from those who know us well also, and be able to discuss that and our current abilities.
Yeah, and just one reason you might want to have a driving evaluation is I can be the bad guy. So it's hard for as adult children to have to tell our parents that they shouldn't drive. It's also hard. You don't necessarily want to mess up the patient-client relationship with therapists or doctors. Sometimes we are just there to be the bad guy. I mean, it doesn't have to be that way, but
Right.
sometimes that can take the burden off of adult children.
Right. Yeah. I know there's some good resources too. Hartford has some resources on how to discuss driving. I might put that in the description as well because it just has good questions and signs and symptoms. And
It's called We Need to Talk.
yeah,
That's a great one.
Yeah,
that has some good question answer, basic level understanding.
right. And conversation starters, I think, for
Right.
healthcare professionals, caregivers, family members, and all that. So we'll put that there too. So is it all or nothing with driving, or do you feel like you're able to release somebody to drive within certain parameters or conditions?
Yeah, so it is not all or nothing. And like I said, we want to figure out how can we keep you driving. If it's safe, we're going to keep you driving. But I do have the option of making recommendations like your ability to multitask didn't work as well when you were going 40 and 50 miles per hour, but you did okay when we were going 20 and 30. So I can put a restriction of speed, no speed over 45, no interstate driving, local familiar only, or a 10-mile radius from home. We have a lot as evaluators, we have a lot of parameters that we can still keep someone driving as long as memory isn't impaired. If memory is impaired, I'm not allowed to or I will not put restrictions because I have no proof that you would remember the restrictions. If memory is significantly impaired. But yes, it's not an all or nothing.
Right. I feel like all that's encouraging. I think there's a lot of fear about seeing a driving rehab specialist or what's the DMV going to do, but you brought up so many good points about how we can help somebody safely return and that the potential is good for many people after a neurological event. And it's our responsibility to be, keep ourselves safe, our people riding with us and people in the community. And you gave a lot of good options to help people get back to driving that way with the right training and
yeah and I think if people have concern, just we as therapists, PTs, OT, speech, all of us can help you walk that road and help figure out what best are you ready to start considering driving, or have you got the skills that it takes to be able to keep driving. Yeah.
Okay. Yeah, that's great. Was there anything you feel like we didn't touch on during this conversation you felt was really important?
No, I think you covered it. I think it's just, we as OTs, we want to keep people safe, but we want to keep them active and doing what their occupation is, what's important to them. And if driving is important, don't be afraid. We'll figure it out together. We want to keep people driving, and yeah.
Right. And I think one thing we could speak to is also just talking about those alternative transportation plans too. So in the early stages, or if we're not ready, or maybe we shouldn't return to driving, just having that conversation with our family members also and friends about what are our other options for driving, and and trying to seek those resources in the community. I know the Council on Aging has some information about that, and we can put a link for that, but that will vary, depending on your region where you live. But those are important conversations to have as well. Yeah. Yeah. I mean, and I think from my perspective, I, I think just the important thing is that it requires an individualized assessment, and everyone is different. And there's no black or white about whether or not you can drive, but it is important to get individualized assessment and training recommendations, and just to know that the potential is there. I think is really important. That you can refer back to the therapist to work, with that client, or you can refer to the optometrist and see if something else will be helpful for them. That's all very positive for many people.
Yeah. Yeah.
So yeah, it's a really collaborative approach we have for
That's
that
right.
goal of returning to drive.
Yeah. And I think I just have to point out, you as an OT reached out and said, I struggle with this. How can we do this? And we've met sometimes and we've figured out, and we work well together because she doesn't have a car, but I've got a car, and we are able to provide services. Both of us can help. If the goal is to drive, let's get there.
Right. And I think therapists too, it's good to encourage them, as you have to me. Just we have a lot of skills. We have the skills to assess all the foundational pieces of driving. And then you help us put that all together by taking that client behind the wheel and really challenging them the way that we can't in the clinic. But that we should be looking at that and having those
Yeah.
conversations and not shying away from those.
Right. Because
So,
we're skilled to make those decisions.
yeah. Mhm. Great. Well, I think we covered a lot here, and we have a lot of links we'll put in that will help you in each of your own communities to get back to that goal of driving. Jan, thank you for being here with us, and it's always great to collaborate with you.
Yes, it is great to collaborate with you too. Thank you for the time.
Yes, thank you. Okay, take care.
Bye-bye.
Bye.